Right. Good morning, everybody. I'm Dr. Anthony Brown. I'm the Executive Director of Health Consumers New South Wales, and I'd like to welcome you all to our webinar this morning on collaboration in partnership and practice with involving consumers in health and medical research. Before we start, I would like to acknowledge the traditional owners of the many lands across Australia that we're all meeting on today. I'm coming to you from Gadigal land in eastern Sydney, and I pay my respect to the traditional owners and to the elders past, present and emerging, and extend those respects to all elders and to any Aboriginal or Torres Strait Islander people who are joining us today. I would also like to acknowledge people with lived and living experience of illness, disease, injury, disability, and being a carer. These lived and living experiences are so important, and both health services and health and medical research benefit so much from the involvement of health consumers and people with living experience. We thank you for all your participation and involvement in these processes, and I want to particularly welcome and thank the people with lived experience who are joining us today. Health Consumers New South Wales represents the interests of health consumers in research and in health services across New South Wales. Since 2019, Health Consumers New South Wales has been working in partnership with Sydney Health Partners to help build and support their members and the capacity of their members to involve consumers and community in health and medical research. Our work with Sydney Health Partners is an important strategic relationship, and the relationship and the work we do demonstrates the importance of collaboration and practice and partnership in practice. Involving consumers and community health research, of course, improves health outcomes and the quality of health research. Effective consumer engagement and involvement, as we all know, is underpinned by mutual trust and respect. And that's something that we have and we share with our friends from Sydney Health Partners, and we thank them for that. This webinar is part of a broader program of work to encourage and support researchers and consumers to connect and collaborate. Before we start, I'd like to encourage people to keep themselves on mute. And if you have a question, to please put it in the chat box or raise your hand. We have 7 speakers, a mixture of both consumers and researchers, who will all be sharing their experiences about involving consumers and community members in research. I'd now like to introduce and hand over to my colleague, Carrie Hayter. Carrie is the Consumer Engagement Manager for Health and Medical Research with Health Consumers New South Wales, and Carrie will be facilitating our webinar today. So thank you, and over to you, Carrie.
Hi everyone, it's really wonderful to be here. I too would like to acknowledge the Gadigal Wongal people of the Eora Nation, whose land I'm coming from today. It gives me great privilege to present our first 2 speakers today, Dr. Stephanie Partridge and Mariam Mandol. Dr. Stephanie Partridge is a Senior Research Fellow and an accredited practicing dietitian in the School of Health Sciences at the University of Sydney. She's held continuous National Heart Foundation and NHMRC fellowships, including the NHMRC NAF Early Career Fellowship and NH Future Leader Fellowship. She currently leads the Youth and Consumer Program at the Engagement and Co-Design Hub. In 2020, she was one of 3 researchers nationally shortlisted for the Emerging Leader in Science Eureka Prize for her research with young people. Mariam Mandol is an accredited practicing dietitian and PhD candidate in the Engagement and Co-Design Research Hub in the School of Health Science, Faculty of Medicine and Health and University of Sydney. She has extensive experience working with adolescents in private dietetic practice and community settings. In her role as a community dietitian, she's gained extensive experience with stakeholder engagement and with the dietetic management of adolescents from culturally and linguistically diverse groups. Her PhD research aims to improve nutrition and health outcomes by optimising youth engagement in obesity and chronic disease prevention, research, policy and guideline development. I'd like to now hand over to Mariam and Stephanie.
Thanks so much, Kerry. So we've got a few slides
Yep.
for our talk.
Can you see my screen?
Yeah, we can just, in presenter mode.
Yeah. Sorry about that.
Excellent. Thanks so much, Mariam. So I'll just give a brief overview and then I'm really excited to be able to hand over to Mariam, who'll take you through some of the exciting findings that we've had from our youth advisory group. But I'll briefly just introduce how we've developed a youth advisory group that we've been working with over the last 12 months. So I'd also like to acknowledge the traditional owners of the land that we're presenting on today, which is the Gadigal people, and pay my respects to elders past, present and emerging. Next slide. So just to give you, as I mentioned, a quick overview, so I'll briefly go over adolescent consumer engagement and the development of our protocol and evaluation. I've been lucky enough to be able to talk about this work twice this week, so that's really exciting. But I assure you in Mariam's talk, you'll hear about the evaluation, which we've just finished our 12-month data collection. So that's a really exciting part of this piece of work that we've been doing. Next slide. So just to briefly talk you through what's been happening in the adolescent and consumer engagement space. So when we started this work around 18 months ago, we looked for frameworks that were published within the scientific literature about how to best engage adolescent consumers within research. And we found that there was a lot of different frameworks that are available for particularly in adult populations, and particularly focused on adults with a particular chronic condition or a particular health condition. So this was just an example of a review that was published, and they had 65 different frameworks for consumer engagement. But what this review recommended, that there was really no one-size-fits-all approach. And in terms of consumer engagement, we really do need a menu of frameworks. But was really interesting for us that there was no framework for adolescent consumer engagement. And we're really interested in engaging consumers in the prevention space. So we're working with young people who are just going about their daily lives, and how can we best work with them to develop interventions and policies to help them stay healthy throughout their adolescence and then into young adulthood. And there was also this other review that was published, which looked at how many young people are actually involved in research that affects them and is about them. And this review was done in 2019, and they found that fewer than 1% of all empirical research, so all original research that was conducted, actually had a youth voice or a youth advisory group as part of that research. So next slide, Mary. So next slide, sorry. Oh, maybe I think Mariam might have frozen there. But on the next slide, it shows the systematic review that Mariam has done as part of her PhD. So Mariam has done a systematic review where she looked at how young people were engaged in that prevention space, and sort of how different studies were engaging them. And so she identified that there were 71 studies over the last 25 years, which involved young people and gave them some level of decision-making within research. But what we found from that research was that there was actually really no consistency in how to evaluate young people's involvement in research, and what do they actually get out of that involvement. Oh, I think she's dropped off now. Hopefully she comes back. But that really showed us that a lot of research that's happening that involves young people obviously is really focused on the research, but it's not really focused on the benefits to the young people, the benefits to consumers in being involved in that research. So the next thing we did after that that led us to develop our youth advisory group, which we've been working with for the last 12 months. So in October last year, we recruited our youth advisory group, which was a really exciting time for us. And we received 32 applicants, and we had 16 positions available within that group. And we were able to select young people from across New South Wales. So we selected New South Wales, so we could bring them all together at some point. And we were lucky enough to be able to do that. And Kerry was able to attend our first workshop that we held with them in July this year. So we ensured that we had a gender balance within the group. We had 50% of our members spoke a language other than English at home, and we had 25% also representing regional New South Wales. And we're lucky enough for one of our members to be featured within a Health Consumers New South Wales newsletter that was released a few months ago as well. So together with our youth advisory group, we've worked with them over the last 12 months, and they've been able to support the research that we're doing as well as us being really able to understand what are the key issues and what's really most important for young people. So one of the first activities that we did with our youth advisory group was that we got them to really tell us what they think are the top issues for young people in terms of chronic disease prevention. So we really didn't want to tell them the research that we had been doing. We really wanted to hear from them, what's most important to them. And that led them to write a statement, which we asked them to write a statement, summarising their top issues. And what they gave us was a 2,000-word essay, and was really exciting that we're able to publish that in a scientific journal. And for these particular young people, that outcome was really important. It's been really important for their education and for their career prospects and what they wanted to do next. I'm not sure if Mariam is coming back. She might be having a lot of internet troubles. Did you want me to share the slides, Kerry? Would that be okay?
Yes, please. Yeah, if you've got them. Yep. Just take a pause. Mariam's just come back, but maybe if you share your slides, particularly if Mariam's got some issues there.
Yeah, sure.
Just while we're waiting, if you want to pop any questions that are popping into your head in the chat box, please do that. Linda Comerick and I are monitoring the chat box. Thank you. If you just put it on presenter view.
Yeah, sorry about that. My internet died.
That's okay, Mariam.
Who's sharing, Stephanie?
Okay. Yeah, is that better? Can you see the right side?
You need to put it on presenter view.
Yep. Okay. Is that better?
No, at the moment we just.
Sorry.
That's okay.
We're not seeing the screen.
That's it.
Yeah.
Well done. Perfect. Yeah. Thank you.
Okay, wonderful. So I briefly mentioned the systematic review that Mariam did as part of her PhD, which led us to develop the protocol for our youth advisory group. And our youth advisory group is grounded in youth participatory action research principles. So as I was talking about before, we asked them what they really, what are their top concerns around chronic disease prevention. So it's inquiry-based. And it's participatory, so youth advisors are collaborators in our research process. And Rebecca really spoke about that at the webinar that we did earlier in the week, where she spoke about how we've engaged young people in the clinical trial that we were developing. And we hope that it is transformative and that youth advisors can actively intervene to change the lives of youth and their communities from chronic disease. I briefly spoke about this before, and just before I hand over to Mariam, who'll take you through the evaluation of the group that we've done over the last 12 months, we really spoke with young people about how they wanted this group to operate and what would work best for them. And when you talk to a lot of people that work with different populations, working with young people, it is really different. You have to be a lot more flexible, and you have to be obviously, they're not as, I guess, the consistency in terms of meeting attendance and things like that.
The P3s are there.
Hello? Oh, it might not be as, it might be very different. So we have monthly online meetings with them via Zoom, and we asked them what platform would be best to work with them on, and that was Slack. So this is a tool that's not connected to any of their personal social media accounts, and it is a platform that allows them to come on and engage, and we can do a lot of collaborative work on there on Google Docs or mural boards or all kinds of digital technology as well. And we have various different channels and of conversations of different topics, and they can chat with each other as well as communicating with us. So this just gives you a brief overview of our research and how the young people have contributed to it. So I guess one of the key projects that they've been working on with us is around digital food access. So they've helped us co-create a study which looks at online food delivery use among young people. They've helped us to design, as I mentioned, a clinical trial. So they've helped with the ethics application, submitting statements to what they believe should be the age of consent for these kind of interventions for young people. And they've helped recruit for our various surveys and focus groups as well that we've conducted. So now I'm really excited to hand over to my PhD student, Mariam Mendo, who's going to talk you through the 12-month evaluation that we've been doing with the group to understand really what are the key benefits that young people are getting out of joining this group and their thoughts on that. So I'll hand over to you, Mariam, and I'll happy to click through the slides for you.
Is it okay if I share my slides just so I can see my notes?
Yeah, sure.
Thank you. Okay. Thanks, Steph. Great. Thank you so much. Good morning, everyone. Before I start, I'd also like to acknowledge the traditional custodians of the land on which I'm presenting from and pay my respects to elders past, present, and emerging. So, as Stephanie mentioned, I'll be going through the evaluation of our health advisory group, which they called themselves HAPPIer, so Health Advisory Panel for Youth at the University of Sydney. So the aims of the evaluation was to evaluate the effect of participation in a youth advisory group on adolescents' leadership skills and perceptions related to health research, and to evaluate the process of establishing and accommodating a 12-month youth advisory group focused on health research, and to understand barriers and enablers to establishment and facilitation of the youth advisory group. The evaluation consisted of online surveys and interviews at baseline, 6 months and 12 months. So do not try to read this slide. This is the Youth Advisory Group Development and Evaluation Logic Model that our work is based on. I'll magnify the box highlighted in the orange on the following slide, and this represents some of the outcomes that we were interested in assessing. So participatory outcomes of interest were self-efficacy, youth leadership life skills, leadership self-efficacy, research skills, and collective participation of youth advisors. And these outcomes are important as they are participatory markers of empowerment and influence. So 13 of the 16 HAPPIer Youth Advisory Group members consented to participate in the evaluation study. 60% of participants were female and 60% were from a culturally and linguistically diverse background, and 20% lived in rural or regional New South Wales. At baseline, 6 youth advisors reported to have had previous experience in a youth advisory group or advocacy. 5 youth had experience volunteering. And when asked about their reasons for joining this youth advisory group, all the youth advisors reported an interest in a career in health or research. A desire to advocate for youth health was the next most popular response, followed by importance of youth representation in the health space, as well as an interest in learning and acquiring knowledge to improve their own health or educate their peers. So when asked why they feel adolescents should be engaged in health research and intervention development, young people told us that health advocacy by youth was essential as they understand their demographic best and can influence each other. They also told us that through their lived experience, insight, and perspectives, they can help tailor health research and interventions targeted at young people. And they identified youth representation in this space as necessary to make health research and interventions relatable and acceptable to young people. However, young people do face barriers to participation, and common barriers reported were lack of opportunities or awareness of them, and this was exacerbated by COVID-19 lockdowns, a lack of time due to school work and extracurricular commitments, and feeling their ideas are often dismissed or restricted by adults. At 6 months follow-up, empowerment, influence, and sense of engagement were the major themes that emerged, while sub-themes included being taken seriously, having the ability to make changes or decisions, learning and knowledge, confidence, skill development, meaningful contribution, representation, collaboration, and opportunities. At 6 months follow-up, participatory outcome data found that all youth advisors reported improvements in leadership skills, knowledge of nutrition and health, confidence and self-efficacy, research skills, and a sense of influence on multiple sectors such as school, community, research, and to some extent policy. Youth advisors reported that youth advisory group participation increased their access to and awareness of health promoting and advocacy opportunities. It enabled contribution to tangible outcomes of participation, such as they contributed to nutrition and chronic disease prevention research projects. The youth advisors authored an essay published in the Lancet Child and Adolescent Health, which attracted significant media attention. The youth advisors were subsequently invited for an interview on Sunrise Morning TV, and the adolescent health concerns were featured on the front page of the Sydney Morning Herald. Furthermore, they met with 2 members of State Parliament to advocate for attention to adolescent nutrition and health, and they were invited to participate as panelists and presenters in national and international events, such as the New South Wales Office of Sport Her Way think tank, the Australian Medical Association Conference, and the International Association for Adolescent Health Conference. At 6 months, the youth advisory group had been implemented as planned. Youth advisors reported the most helpful aspects of the youth advisory group being the frequency of the meetings, that it was a respectful and supportive environment where all views were encouraged and everyone was given equal opportunities. The flexibility, so attendance was not compulsory and recordings were available if they were unable to attend a meeting. The accessibility with its online delivery made it very accessible to even people who lived remotely or in regional New South Wales. While the least helpful components were that there was no choice of guest speakers, and again, the delivery methods, so many preferred some face-to-face sessions, although this was hindered by the COVID lockdowns. So we have just recently collected most of the 12-month evaluation data. We're waiting on a few more youth advisors who are currently doing the HSC exams at the moment to finalise this. So the 12-month data I am presenting is preliminary and analysis is ongoing. However, from the emerging participatory outcome data, the youth reported that participation in a youth advisory group gave them unique leadership, engagement, and advocacy opportunities that they may not have had. Youth valued the ability and opportunity to influence health research, which the youth advisory group gave them. They reported increased sense of empowerment and influence and an ability to make a difference in the world. And this was linked to tangible outcomes. So, for example, like the Lancet paper and media coverage increased their sense of empowerment. They reported feeling heard, and that this feeling increased their confidence and their sense of self-efficacy, and that they reported that they are more likely to engage in future opportunities as a result. They reported improved research skills and soft skills such as leadership and teamwork. The youth advisors also told us that also reported an improvement in their school grades, and this was an unexpected outcome, and it could be from the transferable nature of the research and analytical skills that they gained throughout. Adolescents also told us that participation in health research helped to break down the barriers between researchers in a university setting and them as youth and consumers. At 12 months, the youth advisory group was also implemented as planned. The youth advisors reported the most helpful aspects of the youth advisory group process to be that its online delivery meant it was accessible to all members regardless of where they lived. It was flexible. They liked that the youth advisory group was very organized and the leadership was very supportive of them. They also reported that they felt it was a safe space where they could say whatever they needed to say. And although the youth advisory group delivery was online, once COVID restriction eased, youth advisory group members were invited to attend an in-person workshop on campus at the University of Sydney. And during this workshop, youth advisors had the opportunity to take part in some engaging hands-on qualitative research activities and to meet and network with researchers from various science and health backgrounds. So this in-person workshop was also very popular with the youth advisors. And although the online delivery was reported to be a helpful component, the almost exclusive online delivery of the youth advisory group was reported to also be a least helpful aspect of the youth advisory group process. So yeah, it's a bit mixed there. So challenges to facilitation of the Happy Us Youth Advisory Group included time. So adolescents are very busy due to school work and extracurricular activities and commitments. So we need to be very flexible when working with them. The academic workload can be quite substantial, so we also need to be sensitive to that. And COVID-19 meant that during the course of our youth advisory group, that all monthly meetings were held online and there was only one full day in-person workshop. When we asked youth what they think could or should have been done differently, they reported basically similar to the barriers, so overcoming those barriers, I guess. They reported preferring some choice of the guest speakers, and most wanted the online delivery components to be supplemented with a few more face-to-face meetings or workshops. Overall, preliminary data indicates that a youth advisory group focused on health research provides young people with a platform for health advocacy, as well as capacity to influence health research and intervention development targeted at young people. Adolescents have the capacity to be a positive force for change in improving youth health trajectories at an individual and societal level. However, further research is needed to develop best practice for engaging young people in health-related research. And I'll leave you with a few quotes from some of the Happy Us youth advisors as to why we should engage them in health research. So in their words, one 16-year-old Happy Us member said, "I think it's more relatable if you're listening to your peers because you believe that they know what you're going through and they have the same problems, so they create a much more relatable figure than if you have an adult speaking down to you." Another member said, "I think our views are definitely worth listening to because we also have an interest in our future." Also, a third member said, in reference to the youth advisory group's achievements, "It's really shown people that youth do have a space in research. Talking to my peers, they're so empowered. I know it sounds cliche, but the knowledge that youth can do this." Thank you. That's all from me.
Thank you so much. It's an incredibly interesting presentation. I just noticed in the chat box, and I'll pin Stephanie as well. In the chat box, there was a question from one of our participants who was, "My question is for Mariam. How did you advertise for your youth advisory group, and how did you maintain transparency of the application process?"
Okay, so we advertised online, like via social media, like Instagram and Twitter and various social media, Facebook. And so a lot of them, that's how they saw it, saw the ad. We also advertised through some networks and to other youth that had sort of previously said they were interested in participating in research. So like we had a bit of a database from previous research. And regarding transparency, so 3 different members of the research team looked at the applications, and we sort of shortlisted, and then we came together and we just compared and discussed, we just compared our choices and discussed, and we came up with like our final 16.
And reflecting on that process, is there anything that you would do differently if you're going to do that process again?
In terms of the recruitment, or in terms,
recruitment, and also how you supported the young people to be involved throughout the whole research and the continuing support you're providing.
Yeah. To be honest, in terms of recruitment, I think it was pretty good. I think it would be good to get maybe get a different kind, like sort of a bigger range of young people in terms of maybe some that are from a lower socioeconomic background, maybe less. So I think something, you sort of notice is that a lot of young people that do want to do this kind of work, they might be the ones that are a little bit more proactive, a little bit more high achieving. So I guess it would be nice to see, get more perspectives from a bigger variety of young people, I guess. Steph, do you want to add anything to that? That's my opinion.
Yeah, I'll just add to that obviously, as Mariam said, the ones that do self-select for these kind of programs obviously are proactive and, wanting to really make a difference in their community. But I think one of the things that Mariam and I have learnt from this group is that in terms of the consumer engagement work that we've been doing, we really feel like there needs to be a tiered approach, because not all young people feel confident to be able to go on national television and advocate for youth issues. So just providing different levels of engagement that young people can do. So obviously they can be involved in our youth advisory group, but they may not want to be their face out there and advocating, or they might just want to be able to contribute online and type responses into a forum and engage that way. So I think that's one of the next levels that Mariam and I will be exploring, is to try to provide that sort of tiered level that young people can engage with, and at a level that makes them feel comfortable. Because I think as well, if they get that entry level, then they'll get, as we've seen through our group, they've built their confidence, they feel like their voice matters, and they feel they might want to step up a bit. But just providing them with those different avenues of being able to contribute, I think, is the most important.
Yeah, and it's really interesting about the benefits in terms of the leadership and being able to engage the system of younger people, and the incredible contribution you can see that they may make throughout their life through this journey. So yeah, thank you, Mariam and Stephanie, for that incredibly interesting presentation and the quite wonderful work that you're doing to involve younger people in health research. So thank you so much. Okay. And lots of people are saying in the chat box, best of wishes for your your research, and hope things go really well. So yeah. Okay. I'd like now to introduce our next two speakers, Kelly Foran and David Iverach. Kelly is an incredible consumer advocate who brings a grassroots vision, finding new and innovative ways to work through and around problems. She's the CEO of Friendly Faces Helping Hands Foundation and the Community Innovation Coordinator, New South Wales Health. Kelly is also a member of the Agency for Clinical Innovation and the Clinical Excellence Commission, Consumer Advisory Council, a rural health consumer representative on the Primary Integrated Community Health Executive Committee, on the Global Patient and Family Advisory Board of the Beryl Institute, and the co-chair of Consumer Voices in Clinical Trials Conviction Consumer Advisory Group in New South Wales. Kelly's co-presenter is David Iverach. David has had an interesting career, firstly as a scientist studying pollution, then as a senior policy-making public servant, and finally as a commercial officer and board member in large infrastructure companies. He's had various lung issues since childhood and has experienced the joy of taking new drugs that changed his life. He's participated in several clinical trials, sometimes as the placebo, and follows the development of new drugs and treatments as well as a non-medical person can. He's excited about the enablers and barriers for people participating in clinical trials and the challenges teams face in getting voluntary participants. So I'm going to facilitate this session, and we're just going to have we've called it, Kelly and David have called it Consumers Rumbling About Clinical Trials, the Good, the Bad, and the Challenges. As we go through this rumbling session, please pop any questions, comments, or thoughts in the chat box, and we'll keep an eye on that. So my first question that I thought I'd start with David first is, why should consumers get involved in clinical trials?
Yeah, good question. Can you hear me okay?
Yeah, it's great.
Well, from my personal experience, as you've summed up, I progressively became aware of the critical nature of the development of drugs and medicines and devices as a result of the clinical trial process. And I find that most people that I talk to and explain how that works and how important it is and what it leads to, and get them to actually appreciate that just about every drug and medical device that they're currently using came out of research and clinical trials of one sort or another, they get very open to the idea and then start to get curious about, well, I know somebody or themselves or someone in their family that's got a problem. How do they find out about these things? And that's when the real challenge emerges, because it's not easy. My experience with most general practice doctors is they're not, they and their surgeries are not active promoters of clinical trials. And other than for the few sort of notorious ones about sports, famous sports people getting fixed by some new miracle, there's not a lot of publicity about it. So it's not easy for people to find out, even though I think a lot of people would want to.
And I suppose my experience, is a little bit different. So my experience with clinical trials is about having and hope. So my dad has been diagnosed with a glioblastoma, and even though when and if the trial gets to Australia, and even if Dad might or might not be able to be involved, it's about having that little bit of hope, and also for Dad, it's about being able to give back. Sometimes we all need to have a reason why things happen, and I think for Dad that's what he'd like to do and give back. And since that experience, I certainly would love to be involved in trials. And as David said, it's certainly not promoted. It's doctors don't know much about it at all. So you really have to be proactive. And I think that's the best reason why consumers need to be involved in getting it out there.
And so you've talked about some of the reasons why, but there's a whole heap of barriers, aren't there, for consumers to be involved in clinical trials. And David and Kelly, I might start with David. What are some of your thoughts on some of these barriers, and maybe what we could do to address some of these barriers? But let's talk about the barriers.
Yeah, the more you understand the challenges that companies and research institutions face, you sometimes wonder how the heck some of these things ever get completed, because they're geographically located. So if someone lives hundreds of kilometres away, they can't access the trial site. The rarer the disease, the harder it is to find people that qualify for the trial, and the people that are running the trial often have quite strict requirements about just exactly what the disease or problem might be. And so some people get, just recently I had a couple of friends, because I'm in a stem cell or a double-blind stem cell or a saline solution for my osteoporosis, arthritis knee. And I've had, a couple of friends, and they got excited and they were introduced to it, but they didn't quite qualify because it wasn't bad enough or whatever. And so they were disappointed about that. So and then the people running the trials have this challenge of, they've been through an ethics committee, they're quite limited. There's strict rules about how they can do it. So it's not always easy for them to put something on Twitter or Facebook or something like that. But one of the points I'll let Kelly talk in a minute, sorry, Kelly. But one of the points I wanted to make was the Commonwealth Government's, the Health Department's website on clinical trials does a very good job of explaining what trials are about and, you know, what you can expect and how useful they are, et cetera, but it obviously, and it's been there for more than a decade, it obviously hasn't really addressed the issue of how you get it out to consumers and how you get GPs more involved. And I would think organisations like we've got on this webinar, I think if we all start pressuring the Commonwealth Government to do more with their basic website and integrate that, that could help things a lot, because it's a good start. It just isn't, and it's also very hard to search for the trial that you want, or for people of my age that are not so familiar with websites. I can read the material that comes up, but when I want to do a search on some lung disease, it's not as intuitive as it needs to be for people who aren't familiar with websites. So I think that's an area of research and collaboration with them.
And Kelly, you're the co-chair of the Consumer Voices in Clinical Trials, a consumer advisory group that's been set up across New South Wales, supported by Sydney Health Partners, Health Consumers New South Wales, Access CR, and Northern Local Health District. What sort of rumblings have we been having, have that group been having about some of these things and what we could do to maybe address some of these challenges?
I just think I have to start by saying I think it is the most amazing group that I've been on, for the fact that we're really pushing out some really great projects. You know, we certainly do a lot of talking, and I've never been short of you know, chatting away at something and usually waffling. But you know, we've produced 3 absolutely mind-boggling, I feel, videos to try and get social media out there a bit more, to try and, you know, not entice people, but probably to give people more information as to why they really should be involved. Our infographics and our clinical trials checklist. And I think for me, it's, you know, it's about putting this in front of people and having our posters around and people asking the question, you know, to their doctor, how can I be involved, and why would I be involved, and trying to understand it a little more. I think I truly think it's people want to help, but we need to direct them and point them in the right direction to help. And we also need to open it up. You know, when I first became involved, my dad hadn't been diagnosed, and I sort of thought, why would I be doing this? You know, I really have nothing to give or offer, but I have a son with one eye, and you know, obviously there's a lot of trials, and somebody's working on how to make that prosthetic work so much better, and development and things like that. So, you know, it really is a no-brainer. If we want to make improvements in life, you know, sometimes you have to put your hand up and try to get involved. And the other thing that I was just going to touch on with a barrier is our distance. You know, I'm out, you know, Central West is where my parents are, and just being involved in a trial and getting the bloods done at our local hospital was a barrier. And we had to, you know, bust that barrier where a lot of people might have went, oh, it's too hard. We have to travel to be involved. Well, you know, it wasn't hard to ask the question. And these 3 new rural, regional, remote hubs that we're talking about for clinical trials is going to be fairly incredible. And along with what we've produced in our group, Let's hope we have a lot more people jumping aboard. I'm so inspired by Stephanie and Miriam, you know, involving the youth. And in our group, we had Sonia, had her daughter came along, and she was so excited to be involved as well. So again, I come back to people want to help. We just need to show them how.
So David and Kelly, we've got like a significant group of researchers and clinician researchers on this webinar. So those are the people who are working in clinical trials. What kind of advice would you give to them about how to participate consumers to be in your trial or involving them in the clinical trial? What kind of things would you say to them? Tips of wisdom. David, do you want to go first, and then I'll go to Kelly?
I was hoping Kelly would go first because she's probably got better ideas on these things. I'm not a great user of social media, but I know a lot of people are, and I wonder if there's more scope and how that could be balanced with the ethical and constraints on advertising for trials. And I've already mentioned the Commonwealth Government, the Department of Health's website, which most researchers know about because their trial is registered on that website. But most of the community don't know about it. And as I say, it's not, when you do, it's not easy to track down a trial that you might be interested in.
Yeah.
I'm surprised that, I'd be surprised if we couldn't get some of the media people, television, radio, and then the social media, once they get the message that we're talking about, I would have hoped that they'd be pretty interested in exploring different ways. And obviously it'll be a whole variety of channels, because we're going from youth to age to fluent English speakers to not, you all know those issues. And finally, there's a few companies that are trying to set up databases. I don't know how successful they've been, but I'm sure the researchers online know about them and have approached them, and some of them seem to charge a lot to do not very much from my perspective, but I'll stop there.
Yeah.
And Kelly, your thoughts?
I think my top points would be, like David, make maybe have a consumer designed website that is easy, KISS method, keep it simple, stupid. Maybe we need something like that. I think we need to get it out there why you would want to be involved, for many of us, and myself included, and that's why I do a lot of what I do. I want to do it because I want to help. I want to give back. I think I've dodged two life sentences twice, and I think I'm here for a reason, and that's to help others. And then that's just been reaffirmed with my dad's illness. So I think we just need to keep it simple, but we need to get it out there, why you'd be involved, how you can be involved, and make it easier, and as for me, being rural and remote, these hubs are going to do that, because I truly believe clinical trials does give hope. It gives hope for all of us. And for me, that ticks a huge box in my life.
Yeah, and so one of the things that the Conviction group, the Consumer Voices in Clinical Trials, was trying to do was to get the message out to consumers about the importance of being involved, but also, being aware of making informed choices about clinical trials. And so the video that we will be launching showcases a whole heap of really diverse voices: younger people, older people, men, women, people from diverse cultural backgrounds, Aboriginal people. So it'll be an incredibly rich video. I think that will be useful, that could be played to many people to educate people, particularly the community and consumers, about why you might want to sign up for a clinical trial. And do you want to talk a bit about the group and how we've worked and formed the conviction groups? It's been a really interesting 12-month journey that we've all had, hasn't it, Kelly?
It has, it certainly has. And probably one more thing I'd like to say to researchers is, and that was one of the rumblings that we heard, was feedback of those who have been involved. You know, that some people would like feedback on how it went, how it didn't go. And I understand, you know, David certainly spoke about privacy and issues like that. But, you know, for some people, that's really important. But yes, our group, I, as I said, when I first came to the group, I thought, oh my gosh, I've got nothing to offer. I don't really understand any of this. And it was before my dad's diagnosis. So divine intervention, God, whoever you believe in, I think threw me into this. Well, and I think Anthony Brown was probably one too, who threw me into this group, but it's been an amazing group. In 12 months, I've learned so much, and not only about clinical trials, but about other groups and organisations and other nationalities within our group, and how, you know, the things that I find difficult with rural and remote, you know, is happening in Sydney as well. So that's what we've really worked on hard, Carrie, isn't it? Is our video and our poster, making sure that it hits everywhere, all nationalities. You know, we have beautiful Indigenous people. We have, we've just got everybody in our group, haven't we? And we all just work so lovely together. And I have to say, I feel so very enriched to sit with this group. And you know, David just challenges me every day, and I love that. So over to you, David.
David, let's talk about the future. Like, there's a future. What would you like to see for the future for, you know, clinical trials and consumer participation involvement in that?
Well, to be a bit repetitive, I'd like to see a poster and a video in every doctor's surgery around the country, and I'd like to see a regular program on with the appropriate presenters on TV or radio. They might have a weekly, or even if it's a monthly sort of what's going on in clinical trials around Australia in the last month or something, and have that sufficiently interesting that when people go to work or in their socialising, they just mention, you know, you wouldn't believe what I heard or saw the other day. Do you know that they're doing X and Y for this sort of people? And just it's sufficiently important that it's worth just getting people talking about it. And yeah, that's what I'd like to see. People
talking about it.
Yeah, and I would too. I'd love it to be, you know, a McDonald's, you know, everyone knows about clinical trials and everybody wants to jump aboard the bus.
Absolutely. So let me just share the screen again, just very quickly. Kelly, did you want to talk about what we'll be launching as the co-chair of this group?
Yeah, so we'll be launching a video showcasing our diverse group, and it was done in a circle. Help me out, Carrie. What's the word?
A yarning circle. We had a yarning circle where we came to brought a diverse group of consumers together who just yarned about clinical trials. Yeah, and
it was fantastic. I think we did a good hour or more of filming, and it felt like 5 minutes. So, and it's really rich on some of the really tough things that people go through, as well as the good. You know, as we said, good, bad. We didn't say ugly, we said the rumblings. So I hope that's going to be incredibly powerful, and we're getting that across social media as well with little snapshots, and I think that's going to be absolutely phenomenal. We've also done our infographic, which we're hoping to get out into our hospitals just to try and, get some conversations started and get people to ask their doctors. I know out in our areas, a lot of our doctors aren't informed. And so as consumers, we have to try to be a bit more informed to ask the question. But I think our infographic will really make people think and again, like David said, have that conversation and our clinical trials checklist. And that's just so everyone understands so much more and tries to get more people involved. So as I said, this group has just been amazing. We have produced 3 absolutely phenomenal pieces of work, and if anyone has any money out there, then I think this group are absolutely powering on through. So bring it.
This is just a few comments in the chat box. So from the other side, researchers could advise all GPs of new clinical trials, encouraging GPs to share this with health consumers who are potentially eligible. How to encourage the researchers to do this?
I don't know, but that sounds absolutely amazing. And, again, if people were aware how they could help, I really believe. We used Angel Flight once, and I asked this very young man, why was he involved in Angel Flight, Angels on the Ground? And he said, because I wanted to give back. And he said, within 3 minutes of your mission going up, there was something like 3,000 people wanted to help. So I truly believe, and I think we live in such an amazing world, people want to help. We just have to point them in the right direction and show them how. And that would be absolutely phenomenal if our doctors sort of knew about what's going on and entice people to, not entice, I shouldn't say that, but just give them the information so they can make those decisions.
Okay. Thank you so much, Kelly and David, for your reflections, for sharing what you'd hope to see for the future for consumer involvement in clinical trials, and also for all of, for the incredible work that you've been part of. It's been a collaborative, really, and a partnership with consumers co-creating resources. So we look forward to launching those and sharing that with everyone on this webinar today. Thank you so much.
As the co-chair, I just have to pass back to thank you so much, Carrie, Janelle, everyone who's been involved. It's been very seamless because of your support and direction for us. So thank you as well. You guys are awesome.
Absolutely. I thoroughly double that, and it's been an honour to have been able to participate. And as always, I've learned a lot, and you just can't. It's just such a valuable experience. So thank you.
And I also want to say it's been a collaborative between Health Consumers New South Wales, all the amazing consumers, Sydney Health Partners, Janelle Bowden and Access CR and the Crew Initiative, as well as Northern Local Health District. We've all been working collaboratively. So thank you so much for sharing those learnings. And we really look forward to launching them and getting them out there in the world so that we can improve the participation and future involvement of consumers in clinical trials. Thank you so much.
Thank you.
Carrie, there was one more little chat there. Did you want to just read that? Because that really wraps it up, I think.
Meaningful involvement in clinical trials needs to be inclusive, active, impactful, and not leave participants with the feelings of it just being tokenistic. It also needs appropriate follow-up and for debrief at the conclusion of the trial. Thank you all for the great work you are doing. Let's keep learning from each other. Thank you, Kelly.
Absolutely true.
Okay. It gives me great joy now to introduce the next three speakers in our wonderful session today. Dr. Claire O'Callaghan is a clinical research fellow with a focus on neuropsychiatric symptoms in neurodegenerative diseases at the University of Sydney. Claire's research takes a transdiagnostic approach across different conditions, including Parkinson's disease, Huntington's disease, and frontotemporal dementia to study neuropsychiatric symptoms. Drawing from both clinical and cognitive neurosciences, Claire aims to develop novel neuropsychological assessment tools to detect these symptoms in combination with multimodal neuroimaging and pharmacological manipulations. Claire's goal is to refine our characterization of these symptoms and better establish their neural basis to ultimately improve therapeutic strategies. And John Quinn and Glenys Petrie are research affiliates, board members, committee members, educators and advisors to co-design social care and quality of life research. Since 2014, they've presented at both national and international conferences. John is an outstanding advocate with the living experiences of dementia, Alzheimer's disease of the familial type. However, in 2008, John was forced to leave a 35-year-long educational career, which he loved, and one in which he was respected. He was demonstrating many unexplained cognitive symptoms, but didn't have a correct medical diagnosis. John was eventually diagnosed in 2010 at the age of 59 after 7 years of misdiagnoses, which had resulted in the prescription of incorrect medications. Glenys's advocacy is from the perspective of the living experiences of dementia, as well as living with her own cognitive issues from a traumatic brain injury in a car accident in 2008. Together and individually, they bring a perspective and awareness to a variety of discussions about dementia, intergenerational practices, and ageing. Please welcome our next three speakers. Over to you, Claire.
Thanks, Carrie. I'll just share my screen because I've got both of our slides. All right. How's that looking? You can see my screen?
That's great. Thank you, Claire.
Great. So yeah, all that sort of waffle in my introduction. The main thing I guess you need to know about me is I do a lot of my research is with people with dementia. So trying to kind of understand what's going on with certain symptoms in dementia and you know, working towards better drug treatments. And my background before that was actually working as a neuropsychologist in hospitals, where my job was to be part of a team that worked in dementia diagnosis. So, you know, even though I'm junior in some ways, I tend to think I've got some pretty good experience in dementia, both sort of in a clinical setting and working in research in dementia. But I can tell you, since I've been more involved with working with people like Glenys and John and promoting lived experience in dementia research, I am a complete novice and I'm learning so much all the time. So for me, you know, being part of this has been such an amazing learning experience. So what I'm going to do is I'm going to try and keep my bit quite short, because I think it's more interesting for you to hear from Glenys and John, who are much more experienced in engaging lived experience people in dementia research. I just want to tell you a little bit about practically how we've been doing it over the last few years in terms of a sort of panel that we've set up at the University of Sydney to promote engagement in dementia research. So I'll just start with the more sort of practical side of things to tell you what we've ended up doing. So we have actually launched in about 2018 at Sydney Uni, we launched this big Sydney Dementia Network. And the idea was to sort of get researchers within the university, but also people from, you know, local hospitals and aged care facilities and things like that. So people from all different sort of levels who are involved in dementia research and care, and try to bring them together into the one network. So to promote sort of more collaboration and crosstalk between all of these different sort of arms of dementia, because I think, you know, anyone anyone who's had anything to do with researchers, it's sometimes quite obvious that they're locked away in their little ivory tower and they don't have much contact with, you know, dementia in the real world. So that was part of the goal of the Sydney Dementia Network. And it's going great. We have, you know, sort of over 300 members from all across Sydney, all across New South Wales, actually, of people who are involved in dementia or dementia research in some way. And so, as I just said, the sort of aim of the network was, you know, to sort of increase cooperation between all of these different sort of avenues of people who are trying to work in dementia in a clinical setting or in a care setting or in a research setting. But what could we do better? And we realized actually that the thing that we could do better now that we'd sort of established this big network was actually to increase cooperation between researchers and the people with lived experience of dementia. So, which is getting at the core of what all of the excellent speakers already have been talking about, this idea of sort of engaging people with the research, you know, people who are sort of having the immediate practical experience of this condition and bringing them together with the researchers to sort of ultimately improve the kind of research that we do in dementia. And this is something I've taken from Jane Thompson, who I think might be on the call. I thought I saw her name, but I might have imagined it. And she wrote a really excellent article recently, sort of trying to characterize what we mean when we talk about lived experience engagement in dementia. And so I've taken this quote directly from her paper, and I just wanted to use it to highlight that what we mean, and what I hope we sort of try to embody, is that we want a kind of active partnership, right? I think somebody's mentioned in an earlier talk about, you know, not wanting to feel tokenistic and things like that. And that's exactly what we're trying to avoid. We want it to be a sort of a partnership and collaboration where people with lived experience and researchers are working together to the sort of things I've highlighted here on the left side of the screen, working together to do things like set priorities for research, co-design research, plan research, and then sort of at the final end of things to sort of disseminate or share that research with the public. So the idea is to sort of, create this kind of active engagement where people with lived experience are included and sort of an active part of every single step of the research process. So to do this, we established what we've called the Sydney Dementia Network Lived Experience Expert Advisory Panel, which happily makes a nice little acronym, so LEAP, which is much easier to say. And so we established that in 2020. And it's been going really wonderfully so far. And what LEAP involves is a few people, myself and two colleagues who are people who are dementia researchers, and we sort of help convene the panel. But the sort of, the body of the panel is made up of, at the moment we have 16 members. It's made up of people who either have who are living with dementia themselves, or there's somebody who's had a close friend or a family member with dementia. So these are our panel members who form part of our lived experience panel. And what we did sort of at the beginning to try and sort of, again, from the ground up, make this a collaborative endeavour, we, wanted to make it very official, and we set out a sort of, terms of reference, which we put together with consultation with our panel members. And we discussed sort of initial priority areas of interest and to sort of set out a plan of what we could try to do together by bringing all these people with lived experience and researchers together, and what we sort of envisaged the kind of positive impact this could have on dementia research. And also at the beginning, I think this is an important thing to say, because I think this is something that's overlooked. We established from the outset a means of reimbursing our panel members for their involvement, because I think sometimes, this is not something that's considered, but actually people who are involved in consumer engagement are often, there are people who are sort of giving a lot of their time, and I think it's important to sort of be aware of that and to acknowledge it. And I think formal sort of reimbursement, even I know nobody's doing it for the money, and I don't want to imply that, but I think actually this sort of acknowledgement that these people are willingly giving their time and actively contributing sort of time and effort, I think reimbursement I think can be sort of an important thing to consider. And I know that there's some formal guidelines in dementia consumer engagement where they actually sort of set out ways to reimburse people for their time. So that's how we got things started. And then so since then, the way it's kind of worked in practice is that we have sort of about 4 formal panel meetings per year. And at each of those meetings, we will invite several researchers who submit something that they want feedback on. So they might be submitting an idea for a grant that they're putting in. So some sort of aspect of dementia research that they're submitting for funding. So we've had many submissions of that where we've then gotten feedback from our lived experience panel. Other things might be study design. So if a researcher has sort of money and they're going to conduct some kind of study in dementia, and so getting input from our panel members on how we can do the study better, how it can be sort of better tailored to accommodate the needs of people with dementia and their families, or how it can sort of ask, more relevant questions that could actually, promote sort of better research in dementia. And I might say as well that, we've not just sort of looked at people doing clinical research, in sort of patient populations or in, using drugs in human studies. We've even had some, people who are doing dementia projects, using mouse models and animal work and things like that. So our panel is commenting on sort of, all the whole sort of spectrum of different types of dementia research. So we have those kind of, 3 or 4 meetings per year. And then we also try to organise sort of feedback as needed. If a researcher comes and they've got a grant due or something they want feedback on, we'll try to link them up with some of our panel members. And just to quickly, just to highlight some of the amazing impact that we've already had, even though, it's only been a couple of years and we've built it up from scratch. We've so far had about, just under about 17 or 18 sort of requests for feedback. And perhaps that doesn't sound like much, but when you imagine that a researcher coming to get feedback, they're usually part of a big team. So in terms of kind of the researchers that we've been able to kind of help shape their dementia research based on lived experience input, it's, well over 100 researchers from the University of Sydney, other universities and local hospitals. The things that we've sort of advised on that are already coming to fruition, we've improved study designs to in terms of either kind of the plan or the day plan of how a study might go, or the materials that the questionnaires and things that might be involved in the study. We've helped improve them to make them more appropriate and useful for people with dementia. We've already had a number of people who came to our panel to get feedback on their grants, and that's led to successful grant applications, quite large grants, things in sort of the millions of many millions of dollars, and grants that, can hopefully make a significant impact on improving different aspects of dementia. And something that is one of my favourite bits of impact is that the panel now, with the initial feedback that we've given to research, it's actually led to sort of ongoing involvement where some of our panel members have either been co-applicants on a grant application, or they've been incorporated as part of an ongoing advisory committee. So something that, as a dementia research project is sort of being conducted, we have some panel members who will, meet with the researcher regularly to help advise on that. And I think for me, that's a really special thing, because I think it really shows that, we're not just sort of providing this tokenistic service where we want, researchers come and they get advice and they never think about it again. We're trying to kind of create ongoing partnerships where people with lived experience can sort of really help shape the direction that dementia research is going, and dementia researchers can continue to learn from them. And the main reason it actually works in practice, I can sort of talk, all day about how we've organised it and how we set it up, but it actually works in practice because we have this incredible group of people, who our panel members, who are so engaged and so dedicated, and they work very hard as part of the panel. We send out, material that they need to read, and so they need to prepare before the meetings, and often they're sort of giving wonderful sort of long written feedback, or long sort of verbal feedback, and they sort of approach it with so much experience and enthusiasm. And as the previous speaker, I think it was Kelly, was mentioning, this sort of desire to help and make things better. And it's just, all of our panel meetings are just such a kind of collaborative and supportive and respectful environment. So yeah, the real, the secret sauce of why it works is that we have this kind of, amazing panel of sort of engaged and dedicated people. And with that, and I would like to thank those panel members who've contributed so much. And with that, I'll hand it over to my co-presenters, Glenys and John, who have been part of our panel from the beginning and have helped sort of educate all of us on lived experience involvement in dementia research. So when you're ready, John and Glenys.
Thank you, Claire. And I'd like to thank you for the great work that you do, along with the other two colleagues, in facilitating all the work that LEAP does. It's been a privilege for being part of that particular group for the last 4 years. So thank you once again. So I'd like to say good morning to everyone. Glenys and I are here today speaking from the lands of the Quandamooka people of Moreton Bay. Firstly, I'd like to thank the organisers of Consumers in Health and Medical Research for planning a webinar that focuses on the collaboration between researchers and people with the living experiences in roles that include us as more than just participants or simply as a tick box exercise to fulfil the expectations and requirements of NHMRC, Medical Research Future Fund or other grant submissions. It highlights an awareness of the importance of why and how, hearing the voices, listening to the wealth of knowledge, and recognising the expertise that is specific to someone who's living with a particular medical condition is vital to the quality of their research projects. Ultimately, this leads to research being meaningful, robust, and authentic. I also wish to acknowledge the various health partners who have sponsored the webinar for their insight around the changing global landscape on best practice research principles. As I often say in the context of my own medical condition, I'm more than just another statistic. I'm still John. This is an important message for me to impart in my presentation. Too often I hear from others with the living experiences of dementia that they couldn't do what I can. However, I too didn't realise how our lives and those of others can not only change, but with support can be empowered when researchers involve people with the living experience. At the time of my diagnosis, there was no hope provided to someone living with dementia, back then nor afterwards. In fact, I ended up creating my own hope. Initially, I only saw myself as the disease and lost sight of who I am, of my relationships, and the expertise that I'd accumulated during my lifetime. Because I was reasonably fit young male, it had taken 7 years from the first time that I saw a doctor about the concerning symptoms until I was diagnosed. Both researchers and more importantly others who are living with any medical condition need to understand that I didn't just wake up one morning and become an advisor to and involved with co-design of social and clinical and quality of life research. I too have learnt many things along the way, including live editing of documents. That goes to the patience of researchers to show me. For me, I had to regain my confidence to become an educator again, and for the researchers' mindset to evolve to the point for them to realise that they could learn more from those of us living with the living experiences than from any textbook. And many researchers state that openly now. Glenys and I were surprised that even in today's research climate, some researchers, including PhD candidates, have never met nor worked with people living with dementia. So I based the following on comments made to me by many well-respected national and international health researchers, that ours and others' involvement has prompted researchers to reconceptualise their views about the capabilities of those living with dementia, has changed their perspectives, redirected their focus or expected outcomes of their draft research grant proposals, has resulted in collaboration with us from inception with regards to any consent forms, surveys, terms of reference, or even wording within the documents, etc., to enhance the efficacy of their submission, as well as has enriched the overall collaboration within the entire research team, resulting in respectful relationships and value of our contributions. Such researchers are leading the way and mentoring early career researchers on how it can be done well. I'll finish up with referring to the World Health Organization's recent publications. a blue point for Dementia Research document. It states on page 8, people with lived experiences should be involved in all stages of research, including setting priorities, devising procedures, selecting outcome measures, implementing the research strategy, disseminating results, and turning recommendations into practice and policy. The objectives of including them are to ensure that research is directly relevant to their needs, designed to maximise real-world benefits and minimise or eliminate harm, and is fully consistent with the United Nations Convention of the Rights of Persons with Disabilities and other international and regional human rights instruments. Who continues to go on and says,
Finder hasn't added support for that with Siri.
It also should be involved, they should also be involved in committees that oversee dementia research and be on boards of public and private agencies that award research funds. Their involvement in research should take into consideration their diversity. Many will not have a background in science or skills in research methods. Many will have cognitive, sensory, and/or physical impairments that may affect their ability to engage, so that research teams will have to adopt inclusive approaches to engagement.
Thanks, John. And some of you may or may not have heard that Siri has joined in on the conversation, but we might have to just work around Siri. I'd like to reiterate John's message that no one suddenly becomes involved in research to the level where many advocates are today. It's that advocacy that has changed research to what it is today and will continue doing so. Before I proceed, are you and your colleagues aware that people living with dementia have, since only 2017, had access to the United Nations Convention on the Rights of Persons with Disabilities? Yes, dementia is a disability. I firstly became an advocate when my dad, Ron, had dementia in the mid-90s, and I needed to also become more active in supporting my mum, Joy, who was legally vision impaired. 10 years later, Mum was also diagnosed with dementia. Advocacy raised an awareness in me about how we, who live alongside someone with dementia, can ourselves grow through the experiences because of the richness of the relationships. During that time, I only ever thought of myself as their daughter, never as their carer. Soon after Mum was diagnosed with dementia while John was in his early 50s, he started to show the early symptoms of younger onset dementia. John and I have never been married, although we've been together for 30 years. And so we described ourselves as partners. So with John's diagnosis, which came soon after I had a major car accident resulting in a brain injury, we started to call ourselves care partners. Because of the reciprocal caring relationship, I still don't isolate my role as being the carer. This has resulted in not wanting to be pigeonholed to describe who I am. So I feel challenged when I need to identify as his carer, whether in research or for any other reason. I live alongside John, who's living with a diagnosis, and I sometimes say that he has the living experiences of dementia and I have the learning by experience. I'm not alone in challenging the words used to identify our roles. Children of, parents of, wives and husbands of, etc., still often only want to be identified by their relationships with another person, not as the carer of someone close to them. And because I'm highlighting my relationships with someone, I also don't ever feel that to describe my role as a carer burden. Also, while I'm discussing language and without meaning to sound critical towards anyone else, and I know that I haven't got the answers myself for this, but I'm posing questions to be considered. I'd love this presentation to become a springboard for a conversation about the word consumer in the research arena. I realise it's ingrained in documents and even organisational names, and sometimes there might be times it fits and others not. However, when I consider the primary dictionary meaning as a user of product or goods, with sometimes a reference to research at the end, I never feel as if I'm the user of goods when we volunteer our expertise or time as advisors to, co-design of, or any of the involvement with researchers. And I am pleased to say that there are some groups of people who are starting to pay, particularly more so in the last probably 2 years, an amount of money towards our time and expertise. A number of us encouraged by webinar partners, the University of Queensland, LEAP, and University of Sydney, sorry, thank you, John, LEAP, and Step Up for Research Public Involvement Panel, PIP, or UQ's Evaluating Quality Care, EQC board, and also in Australia and UK's Patient and Public Involvement, PPI. Also recently at a conference in Europe, it was known by the experts of experience, that term was used. So terminology that's been used for at least the last 12 months by Australian researchers in the intergenerational care area, which is now culminated in the Australian Institute of Intergenerational Practice. Maybe none are perfect, but at least each are an improvement on the word consumer. The argument that it's always been consumer isn't valid. Once language is raised, it's all about our responsibilities to challenge what might be an insult to others. I learn something new about dementia every day, and sometimes it's about how we can work together in partnerships to change the mindsets around language. When John and I were asked by researchers to present at a webinar as citizen scientists, I didn't think we were qualified to speak as citizen scientists until it was explained to me by a researcher from one of the actual webinar partners that our advocacy and volunteering of knowledge has already changed the social fabric of community life to improve the lives of many people living with dementia. The example the research provided to me was thanks to my own vision, Brisbane City took the milestone commitment to be working towards becoming a dementia-friendly city, the first capital city in Australia to do so, and also all of the years of community intergenerational practice, including schools that we've been involved with. I'd like to reflect on the paragraph that John read out from the World Health Organization's blueprint document. I'm guessing that many people on today's webinar are surprised by that wording and the WHO's perspective in relation to people who are living with dementia in research. In particular, people living with dementia are central to decisions, committees and on boards, to the point of also having a say in which research submissions gets funded. It might surprise some of you that this has already been happening. About 5 years ago, we were involved with the NHMRC's selection process of the 20 submission finalists for their Boosting Dementia Research grant, with funding of up to $2 million per applicant. Many here today will have the expectation that a consumer in research does, what a consumer in research does, and how a consumer sees themselves. So I'd like to highlight that the research in which we've been involved is more than what many of you thought a person living with dementia was capable of. John and I are not participants nor consumers of research, but for about 7 years, we've been involved with many aspects of research from grassroots right up to the NHMRC. Remember what the World Health Organization was recommending? Well, we've been fortunate to have been respectfully included across these roles and responsibilities for many years, and that's due to the partnerships that researchers have fostered with us. Also, since we started presenting, neither of us have actually referred to people with the living experiences of dementia as PWDs, and I have noticed it hasn't been used today either. It's often used in the general disability sector too. However, shortening the term reduces the person to a few letters of the alphabet. Even on Twitter, when guided by the character limits, I always state the full wording out of respect for the person at the centre of the discussion. I'd like to see that reflected within the grant submissions. It can be done and it's respectful. I hope that John and I have left you some important points to consider, maybe not answers, but things to consider. As I said, it's not criticism, but it's hopeful of opening discussions between you and your colleagues. We'd like to thank Claire, with whom we've connected through LEAP, and for inviting us to for our input in today's discussions. And I'll finish with a quote from Professor Sue Curl in the 2019 Director's Report of Evidence for Change from the Cognitive Decline Partnership Centre's final report. Advocates have been integral to the success of the CDPC, and their involvement has enhanced the reach and impact of our work. Their lived experiences have provided an expertise that has influenced not only our research outcomes, but our individual project teams' approach to the research process. Thank you very much.
Thank you so much. I'd just like to thank John and Glenys for sharing your perspective today, and also Claire as well. I'll now just hand over to Angela Todd, who will thank all our panelists for this incredible session today. Over to you, Angela.
Thanks, Carrie. You know, one of the real limitations of Zoom is that we can't all applaud you. So I will, on behalf of everyone who's here, and say thank you to Stephanie and Mariam for sharing their experiences with young people, to Kelly and David for their perspectives about clinical trials, and of course now to Claire, Glenys and John for your experiences working together in dementia research. I think we heard some really strong messages about the incredibly positive experiences for both consumers and researchers partnering together. What I heard was the importance of that being a genuine partnership based on respect, on sincerity, on a real commitment to working together, to hearing the voices of all of the people involved. I know that researchers sometimes struggle with getting started, but it just sort of feels to me like once you do, it's such an incredible journey and so powerful for all of the people involved. So sometimes it sort of feels like those of us who have embraced the value of working as partners with consumers, and I apologise for that term, people and researchers who also are people but different kinds, that the power of working together and bringing those different perspectives is just so valuable. I'm kind of left with, why wouldn't you? Why wouldn't you do it? It's just too good an opportunity. And if we are committed to best practice research, to high quality research, then we have to involve people who are the people with the lived experiences and the people who our research is actually intended to benefit. So thank you again to everyone. I know we've gone a little bit over time. My last job is to remind you about the evaluation poll. Thanks, Carrie. Is that what you're going to tell me?
I'm just launching it now, Ange. Thank you.
For those of you who are involved in research, whether you are consumers or researchers or anyone else, you know that researchers live and die on the response rate surveys. So I encourage you to spend all of 2 minutes filling in this survey before you switch off. So thank you again for your time, and looking forward to seeing you next time we host an event like this. And sorry, a special thank you to Carrie Hayter, who has managed this whole event today. Thanks, Carrie. Thanks everyone for being with us.
Thank you, everyone. See you later.